Thank you for joining me on this platform of you and your mental health today. Yesterday, we talked about some of the symptoms we should be watching out for when it comes to depression. And of course, today we shall be talking about the depression in women. And of course, it is very important we understand the gender gap. Let me start by saying today that about twice as many women as men experience depression. Several factors may increase a woman's risk of depression. So when it comes to depression in women, there involves some mood changes and depressed feelings which occur with normal hormone changes. Now, I want to tell you that but hormonal changes alone don't cause depression. So there are other biological factors, inherited traits, and personal life circumstances and experiences which are associated with higher risk of depression. So I would like to mention some of those factors that may trigger a depression in women. First of all, I want to let you know that when a woman is going through a puberty stage, which is associated with hormonal changes period, this may increase some girls' risk of developing depression. However, temporary mood swings related to fluctuating hormones during puberty are normal. These changes alone don't cause depression. So poverty is often associated with other experiences that can play a role in depression, such as emerging sexuality and identical issues, conflict with parents, increasing pressure to achieve in schools, sport, or other areas of life. So after puberty, depression rates are higher in females than in male. Number 2, premenstrual problems. For most females with premenstrual syndrome, PMS, symptoms such as abdominal bloating, breast tenderness, headache, anxiety, irritability, and experiencing the blues are minor and short-lived. So it is important to understand that when women are going through this period of life in becoming a woman, quote and unquote, there may be a tendency, a risk of falling into depression. And number 3 is pregnancy. This also brings about changes of hormone and of course can affect the mood of any woman at any time when they are pregnant. And other issues also may increase the risk of developing depression during pregnancy or during attempts to become pregnant. Such lifestyle or work changes or other life stressors, relationship problems, and previous episode of depression or postpartum depression, lack of social support, unattended or unwanted pregnancy, miscarriage, infertility, or when somebody attempted to stop antidepressant medications. This, can lead to depression in women. The other one, which I mentioned briefly the other time, is postpartum depression. Many women mothers find themselves sad, hungry, and irritable, and of course experience crying spells soon after giving birth. These feelings, sometimes called the baby blues, are normal and generally subside within a week or 2. But more serious or long-lasting depressed feeling may indicate postpartum depression, particularly if signs and symptoms include crying more often than usual, low self-esteem or feeling like you're a bad mom, anxiety or feeling up, trouble sleeping even when your baby is sleeping, problems with daily functioning, inability to care for your baby, or thought of harming your baby, or thought of suicide. all this, comes under postpartum depression. So it is very, very important that our women out there understand this. Also, another factor is premenopause and menopause. Risk of depression may increase during the transition to menopause, a stage called perimenopause, when hormone levels may fluctuate erratically. Depression risk may also rise during early menopause or after menopause. So our women need to understand this as one of the major factors that can cause depression at any time. We shall continue with this subsequently, even after today, as we look at how these affect each sexes are affected